Red blood cells is just 4,000 to 11,000. 4,000 to 11,000 cells per cubic millimeter of blood. This is the normal level of WBCs, 4,000 to 11,000. So means what? Means when we see in the blood report of a patient, we'll get WBC like 5,000, 6,000, 7,000. It will come like that. So problem is when it is less than 4,000. Our problem is when it is more than 11,000. So both sides, it is problematic. So normal means between 4,000 to 11,000, right? That's normal. Now let's classify the white blood cells. What are white blood cells? So as you can see in the picture, there is white blood cells are the cells which look white and they are present in the blood, and there are 5 types. Okay, so there are 5 types. We call them as neutrophils. Okay, so let me move the slide. You can see the white blood cells. So they are neutrophils, eosinophils, basophils, lymphocyte, and monocyte. So when we go for white blood cells, we classify the white blood cells into 5 types: neutrophils, eosinophils, basophil, lymphocyte, and monocyte. Okay. Now what are these white blood cells? They are our line of defense. The first line of defense when anything wants to enter our body is the skin. Okay. And what is the second line of defense of our body in the immune system? It is mostly the neutrophils. We say the second line of defense is neutrophils. Or we can say, we can summarize the white blood cells are the second line of defense after skin. Alright. So it means, so these white blood cells like neutrophils, basophils, lymphocyte, and monocyte, they are needed in our body to fight against bacteria or virus or some infection, right? So when a foreign particles comes into our body, we call them as antigens. Mark these terms, we call them as antigens. So any antigen which come into our body, they are counter-attacked by our defense mechanisms called antibodies. So antibodies. Okay. So antibodies are needed to kill these antigens. So these antibodies, they are produced by some plasma cells. They are produced by the plasma cells. Okay. So, and also to kill the antigens, we need these white blood cells. So antibodies just can't kill the antigens by its own. It needs the help of these 5 defense mechanisms, which are neutrophils, eosinophils, basophils, lymphocyte, and monocyte. Alright. So these are the 5 different white blood cells which you have to remember. Alright. So let's go one by one. Now first of all, we go overall that the normal WBC count is, we know, 4,000 to 11,000. Suppose you got a blood report of a patient and the white blood cell count is, suppose for example, it's 15,000. So what does it mean? It means his WBC count is increased. Now why it is increased? So obviously these WBCs, what is their function? They are our defense mechanism. So they are here to fight against the bacteria. So if WBCs are increased, that means what? That means there are presence of antigens, which may be bacteria, which may be virus, any foreign particle. When it goes inside the body, then WBC, their production is increased because they have to fight against it. So if they are increased in the blood, it means there is infection in the blood or infection in the body. Okay, that's what signifies. That's why we check the blood report. So in the blood, you'll find neutrophil, eosinophil, basophil, lymphocyte, monocyte, everything is in the blood report. And again, you can see WBC, that is 15,000 or 16,000. So when it goes more than 11,000, it means what? It means our body is having some infections due to some bacteria or virus, whatever it is. And to fight against those, our WBC production has increased. That's why the number has increased in the blood report. So when you say increased WBC, it means there is some underlying pathology or infection. Okay. Now what happens if WBC decrease? When WBC decrease, suppose someone WBC count is just 2000. So what does it mean? It means his immune system is not good. It means his immune system is down. Like in cases of HIV infection or AIDS, HIV infections, HIV positive in patient or in cases of AIDS, what happens? His immune system is going down. Like acquired immunodeficiency syndrome means immune system is going down. It's not working properly. So that's why. So in any AIDS patient, you will find the WBC is less than 4000. So he cannot fight any infections. So when this system goes down, when our immune system is going down below the normal level, so what will happen? So he's moving outside the home, he's exposed to a lot of bacteria and virus every day, like any other normal people. Once we go out of the house, it's lots of bacteria and virus are in the air. We are breathing it, we are coming in contact with those things, but we are not getting sick because we have an immune system. But if someone has AIDS or HIV infections, his immune system is down. So he will get tuberculosis, today tuberculosis, tomorrow another disease, third day another disease. He will be attacked by so many diseases. Then we call that AIDS. Okay, so that's why you should know the numbers. Okay, so white blood cells normal count, you have to remember 4000 to 11000. More than it signifies infections, less than it signifies immune system failure. Right. Now let's go one by one. Neutrophils. So you can see in the picture that neutrophils, how the neutrophils look like, they are multi-lobe. So this is a cell. Okay, and remember white blood cells have nucleus in comparison to red blood cells. Red blood cells don't have any nucleus, they are anucleated cells. So white blood cells, the nucleus in the neutrophils is multi-lobe. It is more than 2 lobes. Okay, so this is the nucleus, it's multi-lobe. It can be 6 lobes, it can be 4 lobes, but it's more than 2 lobes. Okay, then we call neutrophil. The normal percentage of neutrophil is roughly 60 to 70%. Okay, so the normal percentage of neutrophils is 60 to 70%. And neutrophils are as I told you, they are the second line of defense. They mainly fight against bacteria. Okay, let's say your white blood cell count is increased. Okay, fine. And your neutrophil count is coming. Just for example, I'm giving a number. The neutrophil count of that patient is suppose 85%. So normally it is maximum to maximum it should be 70, right? So 85% means what? Means number of neutrophils in the blood has increased significantly. That means what? That means there is some underlying infections. What kind of infections neutrophils mostly increase? Any sort of bacterial infections. Bacterial infections. So mostly it's the bacterial infections when it increase significantly. Okay, when there is so neutrophils increase significantly in bacterial infections. Then what about eosinophils? The normal eosinophils percentage is 1 to 3%. So let's say 1 to 3%. Okay, and how the eosinophil will look like? Eosinophil will look like it's just a bilobe structure. Okay, nucleus is not multi-lobe; it's a bilobe structure. It looks like a specs. Okay, it looks like a specs. They are bilobe structures. Okay, sometimes it looks like this also. You'll do that in the lab. You'll see it in the microscope. Don't worry. Okay, so eosinophils, they are bilobe structures, not multi-lobe. It's basically 2 lobes. Okay, and the normal percentage is 1 to 3%. Now eosinophils, they are basically responsible for allergic reactions. Allergic reactions. Allergic. So like one of the most common allergic reactions is asthma, bronchial asthma. So when someone has asthma, then what happens? The patient is having difficulty to breathe. Okay, what happens in asthma? The airways become small. So this is the airway, and we are taking air, and suddenly it has become small. Okay, and it has become small. So he's finding difficult to breathe because of the narrowing of the airways. So this narrowing of the airways due to exposure of some dust particles, due to some allergy condition, due to any toxins. So what happens? There is lots and lots of eosinophils are released. So when these eosinophils are released, then it signifies that there is some allergic condition in the background. Okay. So eosinophils, they basically increase in number, that is more than 3%, where in the allergic conditions, allergic reactions. Then next come to basophils. Basophils are less than 1%. Basophils are less than 1%. Okay. And basophils are also, they can be also increased in allergic reactions, and they are also released in, mostly increase in parasites, parasite infections like hookworms, tapeworms. So when these worms are inside the body, these basophils will be more than 1%. Okay, so that signifies, so when we say basophils, it is 1% or less than 1%. Sometimes you will not find even one, sometimes practically in the lab. Okay, so basophils increase means the person has parasites inside the body, like hookworm, like tapeworm, those things. Eosinophils increase means he is allergic to something. He has some allergic conditions. Okay. Neutrophils increase means he has some bacterial infections. He is like any sort of typhoid infections or tuberculosis, whatever bacteria. Okay. The lymphocyte and monocyte. Now remember, all these neutrophils, eosinophils, basophils, they have one thing in common. They have granules. Okay. Granules mean there are some sort of dust particles like inside. We call them granules. So this is the important thing that you will see in the lab. Okay. So neutrophils, eosinophils, basophils, so that's why they are also called as granulocytes, because they have granules inside. They are not so clean. There are lots of kind of granules, we call it as granules, okay, inside. Then coming to lymphocyte and monocyte. So lymphocyte and monocytes are very important for our immune system. Like neutrophils, they also play an important role, very important role in our immune system. Now because lymphocytes, they help in producing antibodies. They help in production of antibodies. And monocytes, they produce macrophages. You must have heard this name before, macrophages. So these macrophages, what they do phagocytosis. Okay. So how these monocytes look like? So in the monocytes, it is very big size, big cell in size, and the nucleus, it looks like a horseshoe or kidney shape. Okay, nucleus looks like horseshoe shape or kidney shape. So percentage is 2 to 8%. Okay. So monocytes, they basically produce what? They produce macrophage. So when any bacteria comes, this monocytes, they modify their shape. They change their shape to macrophage. Okay. Like let's say this is a macrophage. Okay. So they change their shape and soon they will engulf. They will swallow the bacteria. That swallowing the bacteria inside is called phagocytosis. Where is that? Phagocytosis. Okay. And soon they will swallow the bacteria inside. So this bacteria, they have swallowed it. Okay. And they will kill it. So that process is called phagocytosis. And that modified portion of monocytes are called macrophages. So normally monocytes in the blood, they will look like this. So sometimes when you sit in the microscope and when you look in the microscope, you will see the monocytes. There are some monocytes like this, and there are plenty cells like this. What are they? They are macrophages. They are just modified version. So increase lots and lots of macrophages in the blood film also signifies infections. Or monocytes more than 2 to 8% also signifies infections. So monocytes, they increase, very common condition, they increase in malaria, like any sort of malarial infections, tuberculosis. Monocytes significantly they increase, like in malaria and tuberculosis. Okay. Okay, so we forgot about lymphocyte, to mention about lymphocytes. So lymphocytes are where? So after neutrophil, lymphocytes are most common thing that is found in the blood. In regard to white blood cells, they are basically 20 to 40%. So increased lymphocytes, suppose you got the lymphocyte count as 45 or 56 or 60%, means whenever there is increase. So what does it mean? So it means their lymphocytes mostly increase in viral infections. Remember viral infections? Tuberculosis, they increase tuberculosis. Okay, so they increase in mostly in viral infections. Now in both the bacterial infections or viral infections, there will be fever. There will be fever, okay? But we can differentiate when we look at the patient. Like suppose in bacterial infections, most commonly in bacterial infection, when the infection is because of bacteria, the fever is always up and down. It's coming and going, coming and going. While in viral fever, the fever is always at a constant level. It remains at a peak. It goes up, and then gradually it comes down. And during that going up, there will be lots and lots of cases of joint pain. Patient usually complains of joint pain. There is lots of pain in the joints. So that's how by history we differentiate whether the fever is viral or bacterial. So in viral fever, there will be body ache, can't walk. There will be pain in the muscles, pain in the joints. Those are viral fever. And the fever always goes at a peak. It goes very high and then it remains. But bacterial fever, like I told you, there is no history of joint pain. And usually it is just like it comes in the morning time or evening time, and then it goes off. Next day, half of the day the patient is okay. Again the fever came back. That is the usual pattern. They come and go. So every infection, the fever has a definite pattern. Like for example, the patient is having a tuberculosis. So in the tuberculosis, fever is mostly in the evening time. The fever comes in the evening time, and by the morning time, fever goes down. Okay, but in the typhoid, in the bacterial fever like typhoid, the fever is in a step ladder pattern. It is just like stairs. Today is like 38 degree, tomorrow is 39, day after tomorrow 40, is going up every day. Okay, so that kind of knowledge we need to have to examine any patient. So we are discussing about white blood cells. So in the white blood cells, we know now that it has 5 different types of cells: neutrophils, eosinophils, basophils, lymphocytes, monocytes. So we need to know the numbers and we need to know about their functions. So together they all do they play a very vital thing in the immune system, that they protect our body from any sort of antigens. Now what is the common thing when there is an infection? What happens? When there is an infection, what happens? There is fever that I was discussing. So let me give you a brief idea about fever. Fever, or we call it pyrexia. Okay, in medical terms we say it pyrexia or fever. So what is our normal body temperature? Normal body temperature is 37.2. That is the range, 37.2 to 38.3. Okay, or in centigrades. Okay, so now I am not giving you range, just 37.2 degrees centigrade or 99 degrees Fahrenheit. So this is a normal body temperature. Say normal body temperature 37. Okay. Now what happens? Why there is fever when there is infections? Let's say, for example, so a bacteria comes to your body. Let's say this is a bacteria. Okay. He is very angry and he came to your body. So he went and he is coming to your body. He went inside your body through any means, by injuries, cuts, by bleeding. He is inside your body. So what will happen when the bacteria comes? So our body then, from the blood, what will happen? There will be lots and lots of WBCs will move out. Like here there will be neutrophils, eosinophils, basophils, lymphocytes, monocytes. Depending upon which type of bacteria is there, they will go out. So what happens? There is here battlefield. So this is our protective things. Okay, they are protective things. And this is the bacteria. So now bacteria, this antigen or the bacteria will fight with antibodies. So during this battlefield, what are the other things that are? Other things is that during this battlefield, there is some release of some what is called inflammatory markers, some markers, inflammatory things that causes lot of things. Okay, just for examples, we call cytokines and interleukins. Okay, these are released. They are also released in the field. Apart from that, what happens? Now, what will this bacteria do? Obviously this bacteria is having a gun which can shoot some bullets. So it will shoot some bullets. We call them as toxins. Okay. So these toxins are endotoxins or exotoxins. So some are endotoxins, some are called exotoxins. Not going to the classification. Just remember, this bacteria will come and shoot their bullets. So toxins. Now these toxins, when they are secreted, so what will they do? So during this time, what is this toxin? They are attacking our host. They are attacking our army here. So during this time, there is lots and lots of cells which are present here. They will be also damaged, right? You understand that it's called collateral damage. When there is a two party fighting with each other, there will be obviously some collateral damage around the battlefield. So same thing happens here. So when there is a fighting between the antigen and the antibody, there is some collateral damage. Means what? There are some innocent cells that dies. So let's say this innocent cells dies. They are dying. So when a cell is dying or cell wall is damaged, so what will happen? They are released. So when a cells die or cell wall is damaged, they release one chemical called as arachidonic acid. Arachidonic acid, or we say AA. Now as soon as this chemical is released in this battlefield, they will be immediately converted to a type of another chemical we call as prostaglandin. Okay, we call PG prostaglandin E2. There are different varieties of prostaglandin. So this PG E2 will be released. Okay. So what is happening during this thing? There are some cell walls are damaged. This host and this bacteria is fighting, and this chemical is being converted to this another chemical called prostaglandin. So this whole thing, this reaction is mediated by an enzyme called cyclo-oxygenase. We call it COX. Cyclo-oxygenase. There are different types of 1 variety and 2 variety. COX1 and COX2. Okay. Cyclo-oxygenase means cyclo-oxygenase. Okay, cyclo-oxygenase. Now once this prostaglandin E2 is formed, what will happen? It will go in the blood. It will go in the blood. This PGE2 will go in the blood, and it will reach the brain. It will reach the brain. Okay. In the brain, what is there? In the brain. Okay, let me draw the brain here. Okay, the small brain. In the brain, we have one small interesting part of the brain. We call it the thalamus. We call it the thalamus. Below the thalamus means below the thalamus there is one important gland organ. We call it the hypothalamus. Hypo means below. Okay, I'll repeat it. Don't worry if you don't understand. Let me finish it. Hypothalamus. So this PGE2 will go and hit the hypothalamus through the blood. It will go through the blood and it will hit the hypothalamus. Now what is there in the hypothalamus that we are worried of? Okay, let me. So let's say this is a hypothalamus. So this is a hypothalamus. I just zoomed it. So this is the hypothalamus. So the hypothalamus is that part of the brain which maintains our temperature. So hypothalamus has a temperature regulation. Okay, it's a temperature regulation. The 37 degrees centigrade. It maintains the temperature. So 38, 39. But it has a clock. It has a clock kind of thing. It maintains our temperature. Like you switch on the aircon, you can control the temperature, like 37, 38, whatever you click the button, the temperature will change in the aircon machine. Same way, the hypothalamus has a temperature regulatory remote control. So it always keeps our body at what? It always keeps our body at 37 degrees centigrade. That is called set point. It's already set our body temperature at set point. Now when this prostaglandin E2 are released in the blood, what they will do, they will go to and attack the hypothalamus, and what they will do, they will come to the hypothalamus and move this temperature knob to higher set point. Like it will move, it depends how many prostaglandins E2 or PGE2 released. So suppose it has moved this, it has pushed it, and let's say it has fixed it here. It has put it in the 39 degrees centigrade. It moved it. So now the new set point in the brain is 39 degrees centigrade. So when the in the hypothalamus, the temperature knob is rotated to 13, like just your gas knob or any other knob, is normally at 37. Now something came up and someone came up and just make it 39. So 2 degree higher. So when it makes the 39 degrees centigrade, so what will happen? Rest of the body don't know what is the normal set point. They are just always trust hypothalamus. Hypothalamus is saying 37, so rest of the body also responds at a 37. Now suppose you just make out of the blue, you came from somewhere and just put the knob at 39. So means what? It went to the 39. So how the rest of the body will respond? So rest of the body is thinking, okay, our new temperature, normal temperature is 39 and we are at 37. It means we are 2 degrees down. So let's go and match it. Let's go and become 39 degrees centigrade. So to reach the 39, what will happen? Our body will try to produce heat. So what will happen? The body is contracting, all the muscles will be contracted. So when you are contracting, it's producing heat, and heat is being conserved. Okay? So as it more and more contract, as it more shiver, as it contract, what is happening? The body is conserving heat. So that when it's conserving heat, it's trying to reach the temperature. Rest of the body temperature is still at 37. Just hypothalamus, we make it 90. Remember. So our body will try to reach 90 according to the hypothalamus new protocol. That is 39 degrees centigrade is your new temperature, right? So to reach 39 degrees centigrade, main thing that it happens all around the body is vasoconstriction. Okay, wait. We call that. So all the blood vessels will vasoconstrict. Constriction. So what is vasoconstriction? Vasoconstriction means, suppose this is an artery. Okay. So this is the normal size of the artery. So when we make this artery big, we call vasodilatation. It's dilated. It's big in size. And when the same artery is becoming narrow, then we call vasoconstriction. So the body will, what will happen? All the blood vessels in our body, they will just simply go smaller in size. They will reduce in size because they want to conserve heat. So vasoconstriction will occur. Okay, to reduce the heat so that the temperature in the body, they reach up to 39 degrees centigrade. Now your normal was 37. Suddenly I came and put your knob in 39. So what will you feel in the rest of the body? It will feel cold, right? Because you are below the normal temperature. Normally you are 37, but I made you today. I just came in the morning and put the knob at 39. So you are 2 degrees behind. So that's 2 degrees behind. Body don't know this is because of bacteria or this is because of virus. But today our new temperature is, normal temperature for today is our 39. The body will respond according to the new temperature. Every day it's at 37, but suddenly I came and put it in 39. So what will happen? So my body will now fight. It will try all the measures to make the rest of the body to 39 degrees centigrade. In the real sense of to 39 degrees centigrade. So it will conserve energy. All the blood vessels will become narrowed, which is called vasoconstriction. And because it is now new 39, so it is less than, so and our body was at 37 and you made it 39. That's why because of that 2 degrees less than the new code, you will feel cold, you will shiver. That's why when we have fever, we feel cold. We feel cold, why? Because we are still less than 39, what has been newly set temperature. Okay. Are you understanding my point? So that's why when there in the fever, there is shivering. There is feeling of cold. So why there is shivering or cold? Because of vasoconstriction. When all the arteries will become narrow, we will feel cold. And we are down, we are less than 39 or 40 degree, whatever the new degree centigrade has been put it down, we are less than that. So we are feeling cold because now our new temperature that has been set by the bacteria or virus, whatever it is, as suppose at 42 and my body was at 37. So I'll feel cold because I want to reach to 42. So my body will do all the adjustment by constricting the blood vessels, by contraction, by feeling cold, you are taking blanket, whatever it is, you are trying to reach 42. And in that heat, what will happen? Heart rate will also go faster. So because of that heat that is producing, heart is also now, heart rate normally which is 72 beats per minute, normally is 72 beats per minute, it will be more than 72 or you can say more than 100. So you cannot have a case like a person who is having fever and his heart rate is 72. That's how we catch sometimes many of the fake patients. When they say I'm having fever, we just check the heart rate. Heart rate is still at 72 or 80. Okay, it's not above 100. Any cases of fever, body is trying to reach the new set temperature. Yes, he'll feel cold from inside. He'll feel cold, but your temperature will not show cold. It will be just 38 or 40, 41, whatever it is. But he will feel cold because mentally now he is below 39 of new temperature, below 40. But what will happen? What is happening? Because of that heat production, which is the body is trying to reach, it is producing increased heart rate. Okay, suppose I get a patient is saying I am having high fever. And I check the heart rate is simply at 85 or 82. It is below 100, right? So I will not say he is having fever. That's a fake. You cannot have a normal heart rate and high fever. Are you getting my point? So these are the things that happens when a fever. Now why there is fever? Again, let me recap. Why there is fever? Fever is because of prostaglandins E2 that attack the hypothalamus. Why there is prostaglandins E2? Prostaglandins E2 are released when there is an antigen-antibody fight. When there is cells are damaged, tissues are damaged, they release prostaglandin E2. From where this prostaglandin E2 are made? They are made from this arachidonic acid which are released during this part. And they are being mediated by this enzyme. That means what? If we give some medicine like Panadol which can block this enzyme, it will not produce any PGE2. So that's how these antipyretic tablets or Panadol and ibuprofen, these tablets that are used for fever, what they do? They are COX blocker. They block this enzyme. So when you block this enzyme, this reaction cannot take place. So when this reaction cannot take place, there will be not enough PGE2 in the blood. So when this PGE2 is not in the blood, it cannot move that thermal knob. It will just be at 37. So fever has gone down. Or fever is not there because you have taken Panadol or Brufen. So these tablets, what they do? They are all COX blocker. So 50% of anti-fever tablets, 80% of painkillers, they are all these COX blockers. So mostly because of these prostaglandins. Alright, that is one thing. Now, suppose there is a fight now and gradually antibody or these neutrophils, they have killed the bacteria and gradually this war subsides down. There is no more battlefield. So gradually what will happen? The PGE2 level will also go down. So when PGE2 level will go down, this thermal knob will again come back to its normal setting. So when it's coming back to normal setting, means it has to reduce the temperature now. How will it reduce the temperature? By sweating. So now when this knob will come back, this whole thing, the narrow blood vessels will dilate. It will again come back to its original size. During such size, there is lots and lots of fluids will be sweating out. The fluids will move out. What we call the sweating. That's why in fever you will feel cold, then you will very hot, and then you will sweat. That is a what we call, that is a flow chart, that is a sequence that takes place in the course of fever. And plus, if you are having joint pain, we say that it is a viral fever. If there is no joint pain, we call it a bacterial fever. Bacterial fevers are mostly up and down, coming and going, while viral fever, there is a constant route. Now viral fever, it goes like this. It goes, take a flight, take off, it goes up to a certain degree, and then it comes back. It takes its own course for 6 to 7 days. And you can just take Panadol at there, or painkillers, whatever it is. Now what is the thing that you have noticed here in all cases of fever? Thing is that every day you will have fever, you will have sweating, right? If fever will come down, you will have sweating. Sweating means what? You are losing water. So losing lots of water can lead to dehydration. So in any cases of fever, when a patient is sick, the main thing we encourage is to drink plenty of fluids. You have to maintain that the patient don't go for a dehydrated stage. Okay? Dehydration, you understand. Dehydration means what? There is a less loss of water in the body. Okay? So that thing we need to maintain. Okay? So, okay, let me answer the question. So question is, why we have to wait for our temperature to drop before we might take a shower? What will happen if we don't wait? Who told you to take shower? I don't understand your question. Why you have to wait for a temperature to drop before you might take a shower? I'm not getting your question actually. Okay, I'm getting a little bit of thing, phenomena. Yet the question is, probably you are asking me like this, that if you went for a jogging and some exercise, we always tell that don't take shower when you are so hot. Okay, first you come down and then you take shower. Okay, fine. That's not a question, very good question in relation to this topic. We are discussing a fever. So if you come down, now look, when you are exercising, when you are doing exercise, do you think you are having fever? No, our body temperature doesn't go from 37 to 38. It's the external body temperature that has increased. That's not fever. We feel warm, we feel hot, but our temperature is here. Core body temperature, inside temperature is 37, 38 degrees centigrade. Is there. Now, cooling means what? If you take, before taking shower, if you cool yourself, then the heat will go out by its own. But if you just come and after severe exercise, if you just take the shower, what will happen? The heat will be inside. It's not yet gone out. So to let the heat go out first, and then you take the shower, that's an ideal thing. Suddenly you have cooled it, and your heat is all inside, so it might come out later on, and you'll sweat a lot later on. Okay, that is the thing. Sometimes patients say they are having fever because of that. Okay. Okay, let's not go to the shower and thing. I want to stick to the fever point of view. It's up to you whether you should want to wait before shower or you don't want to wait before shower. It's up to you, totally your decision. Okay, I respect your decision. Okay, let's not go for shower. We come to white blood cells. So when we say white blood cells, it's fight against infections, right? So when there is infections, there is fever. When there is fever, there is heart rate will increase and body temperature will increase. So we know now how the body temperature increase. Okay, because of a setting of a new set point where in the hypothalamus. This hypothalamus is below the thalamus in the brain. Okay, because of the new set point, our body is trying to reach that. Now, very interestingly, let's say a 6-month-old baby has a fever. Okay, now a 6-month-old baby cannot tolerate this sudden shifting of temperature from 37 to 40 like an adult body. They cannot tolerate it. So now when we have fever, we also shake. Okay, we contract, all the muscles are become contracted, they contract. So in a baby, how they react when their temperature changes? They will also shiver. The baby will shiver. So most of the time, parents bring their baby to the emergency care that they are having seizure or epilepsy. They think. Okay, when a baby or 1-year-old or 2-year-old is having shaking like epilepsy, don't think this is epilepsy. That is because of high fever. So less than 5-year-old, when they have fever, they might have a body shaking. Okay, and people often misdiagnose it as epilepsy or seizure. Okay, what I'm telling you, if that thing happens, just check the temperature. One anxious parents just brought their child or kid and saying that he just had a seizure at home. Just check the body temperature. You'll find the body temperature is high. It is more than 37. So because of that nature, okay, because they are trying to reach, so they are having seizures. So because of that physiology thing, so many of them are misdiagnosed that a baby has a seizure. Remember, that's called febrile seizure. Febrile means fever. That's called febrile seizure. Febrile means fever, febrile seizure. But that's not a seizure. That don't need any medicine. Just Panadol will be good enough. Remember that. If an adult is having like the seizure, they are having this, then you can say it's a seizure. But if a baby is having a seizure or 1 year old, 2 years old is having seizure, then make sure you record the temperature and see the temperature high or low. So in cases of high temperature in a baby or in a kid, they can have a seizure kind of thing, but it's not seizure. So Panadol is good enough for the treatment. No need to panic, and no need to think about anything else. Okay. So do you have any other questions? So sir, if any baby is sick, high fever, is it good to take their clothes off to drop the temperature? Yes, it's very good. We'll discuss that thing about the fever. So when you fever, that's why in fever, we should not give immediately, or we should not take immediately a set of Panadol or paracetamol. Remember. So first we should always try a wet sponge. But taking shower in fever is not a good idea. Okay? So just sponging with a wet cloth is enough. If the temperature is not coming down and it's still high, then you can go for a Panadol or what you say, paracetamol. Now remember, paracetamol comes in 500 mg, and if you are taking a lot of paracetamol, it's not good for your liver. Paracetamol can cause liver damage. Just like an alcoholic, when a person takes alcohol, what he damages? He damages his liver. Similarly, if you are taking paracetamol every day or any time, you are also just like an alcoholic, you are damaging your liver. Now, in the way he is damaging his liver, you are also damaging your liver. And it's very soon you cannot digest your foods, lots of gas, okay, and lots of every time you have a food, you want to go to washroom. This type of things happen when you are continuously or frequently taking paracetamol. Because paracetamol is also toxic like alcohol. So use it wisely, just whenever you need it. Otherwise, just sponging or removing of the clothes, giving a wet sponge is enough to control the fever. And fever will come down. Once the PGE2 prostaglandin will come down, it will come down. But if it is high, you are having joint pain, if cannot, then you should go for paracetamol. I will not stop you. So when you take Panadol, that blocks the COX-6 reaction. Don't say COX-6 reaction, we say they block the COX-1 and COX-2 enzymes. Okay, they are COX blocker. They block the COX, cyclo-oxygenase enzyme. Okay. Now what happens to the bacteria that was causing that infection? So what happens to the bacteria? That depends upon our white blood cells. That bacteria will be killed by one of those our white blood cells, either by neutrophils or eosinophils, monocytes, lymphocytes. Depends upon which type of bacteria or which type of virus is there. So that is a separate story. In the battlefield, that battlefield is going on. And during that battlefield is going on, prostaglandin E2 are more and more produced because more arachidonic acids are produced. So as long as the battle will go on, as long as prostaglandin's PGE2 will be produced. More PGE2 will be produced, more fever. Now there are also non-infective causes of fever also. Fever can also occur in cancer. Fever can also occur in rheumatoid arthritis, rheumatoid disease, rheumatoid arthritis, or SLE. These are autoimmune disorders. Autoimmune. There are no bacteria here. Okay? Now, these are called autoimmune. Now, what are autoimmune? Now, we know whenever there is antigen, our body fights it with the help of antibodies. Now, someday, in some unfortunate people, these antibodies, they go mad. And they start, no antigen, but they start killing our normal cells. they start killing our normal cells. So when they go mad, we call it as an autoimmune disorder. So most of the kidney disease, most of the joint disorders, they are all autoimmune disorders. Even diabetes also is an autoimmune disorder. There are two types of diabetes, type 1, type 2. Type 1 is autoimmune disorder. So when you say autoimmune, auto means own, immune, you know. When our antibodies that are coming from lymphocytes and monocytes, lymphocytes and the plasma cells, they are killing our own cells, then we call autoimmune disorders. Now when there is an autoimmune disorder like rheumatoid arthritis, SLE, or when there is a cancer is not an autoimmune disorder, it is a cancer. So these are autoimmune disorders. So in any case, these are not because of bacteria, but even then there is fever. In these cases also you will get fever. Why? Because when fever is not only caused by prostaglandin E2, it's also caused by another two things, that's interleukins and cytokines. Interleukins and cytokines. Interleukins are again 1, interleukin 8, there are varieties. Okay, for example, let's say this is a monocyte. Okay, monocyte, we know the horseshoe shaped nucleus or kidney shaped nucleus. This is a monocyte, and there is a bacteria. So this is a bacteria. Now when the monocytes, what the function of monocyte, they will try to engulf it by doing phagocytosis. So now this monocyte has come and there is an attack and it has engulfed it by the process of phagocytosis. So this bacteria is set. It has been engulfed. Now during this engulfing, when it tries to engulf, these monocytes also release some interleukins 1 and 8 cytokines. Like these are called chemicals. They are chemical mediators or they are inflammatory mediators. So they also release these things so that they want to trap. So they are also released whenever there is any bacteria or virus, or when it is fighting it and our antibodies in our immune system. When the fight is going on, not only arachidonic acid is converting to prostaglandins, there are many things, other chemicals also being produced in the same battlefield, like interleukins and cytokines. These also can stimulate hypothalamus and can cause fever. So it does not mean if someone is having fever, it means he is having infection. Someone is having fever, he might be having cancer also. He might be having some joint disorder also, like rheumatoid arthritis, SLE, thyroid problems, diabetes. So fever can be produced because of infection. It can be produced because of non-infection also. Okay.